afternoon, everyone. So I'm very happy to be here today. Actually, I did participate to the conference last year. And what I really actually enjoyed the most was the interaction, with all the students actually in public health. So I think it's a great opportunity as well to exchange ideas on health systems and hear from students, but as well to hear from different partners, including, ministries of health, development partners. So thank you very much for the opportunity. So I'm going to talk about climate change and human health. It's a very hot topic, as you know. The COP28 actually is happening right now. And for the first time in a COP, in the history of a COP, there was a health pavilion. So the health sector, the health system is actually, like getting more, I would say, more starlight, in terms of the climate change agenda. And very interestingly as well, one of the key outcomes of the COP28 was that 164 countries have signed actually a declaration to do more on climate health actions. So I think this is actually a good outcome of the COP28. So in terms of the presentation, so what I wanted to discuss about today was really to give you the big picture. So the presentation is organized in three parts. So the first part, basically, we are looking at the effect of climate change on human health, globally, but as well as in India. The second part is really looking at the policy responses. And the third part, the way forward. Okay, so this is very much a background slide, but I think here the main message I wanted to highlight is really the fact that climate change is a health risk multiplier. That means, so climate change, of course, you all know what it means. I mean, it's really this long shift, in the Earth average temperature and the changing, weather patterns, which leads actually to more climate hazards, or as well what you call the exposure pathways. So you have different types of exposure pathways. You have extreme weather events, you have heat stress, air quality, water quality and quantity, etc. And those, climate hazards then actually multiply the health risks in different ways. For example, if we take air pollution, which is a climate hazard, it can lead, to actually a multiplication of hospitalization related to respiratory disease, cardiovascular disease. If we take, for example, as well, extreme weather events, it can lead, to more outbreak of waterborne disease like diarrhea, like vector-borne disease, for example. Let's take the example of dengue. I've been hearing a lot, about the fact that now dengue, actually in the One Health session, is now becoming endemic. You used to have that in India in certain months. Now it's actually every month. So actually dengue, it's very interesting. I was reading an article which, was saying that before 1970, only 9 countries had actually dengue. And today, it's like dengue is endemic in more than 100 countries, and actually is leading to about 100 to 400 million infections on a yearly basis. So really the effect of climate change on human health is really real. And as well, there were some studies done by WHO which were saying that between 2030 and 2050, there will be an additional 5 million deaths, fatality, due to climate-related disease, malnutrition, diarrhea, malaria, and dengue. So clearly, when you think about climate change, I think it's important to have in mind, okay, this is a health risk multiplier. It multiplies all the health risks. Hence, it's important really to have a resilient health system. Oh, I think one of my slides disappeared. Okay, so let me continue on this slide. But there was a slide on universal health coverage. Because I think sometimes when we frame, climate change and the effect of human health, we forget to kind of link with universal health coverage. So universal health coverage, all of you know what it is. It's making sure that everyone has access to quality healthcare services, preventive services, etc., without having any financial burdens. And so the way climate change links to actually universal health coverage is that when you do have an extreme weather event, what does happen? Well, what it happens is that it can actually discontinue the provision of healthcare services. For example, you have floods. Let's say there is a pregnant woman. She might not be able to deliver her baby at health facility level, right? So it actually does discontinue service provision. And as you know, universal health coverage is measured by these universal service coverage indicators. So all these targets, for ANC4, institutional delivery, etc., might not be reached because of those climate hazards. That's number one. Another way of measuring universal health coverage is through financial protection, catastrophic health expenditures. And a couple of years ago, the World Bank did a study, and it showed that if nothing is done on climate change, 120 million people will be pushed into poverty, extreme poverty. So will actually be in such a way that they will be living only with $2 per capita. And 1/3 of these people were pushed into poverty, so living with less than $2 per capita because of the expenditure spent on climate-related disease, climate-sensitive disease, like dengue, heat stroke, malaria, etc. So this is really a policy issue that needs to be really, addressed, because this is affecting universal health coverage. And in particular, what we note as well is that when you look at, those countries which are affected by climate change, they are the one as well which have actually the lowest, indicators in terms of universal health coverage, targets. So there is a lot of inequalities with respect to, to the climate health agenda. So now it's just to narrow down, to Asia and to India. What we note is that actually, so Asian countries, and including India, is very much at risk of climate change. I mean, if you look at the global climate risk index, so India has one of the lowest score. And this global climate risk index is actually measured, so it's the effect of climate hazards in terms of fatality and the economic loss. So clearly there is an issue worldwide, in particular in Asia, and then most particularly as well in India, as you know all very well. So these are some of the effects of climate hazards on human health in India. I actually did borrow these slides from the team of Dr. Akash, who is the director of the National Program on Climate Change and Human Health in Delhi. And so basically, the effect of climate change on human health are broadly summarized in 4 buckets. Perhaps we could add another bucket on extreme weather events and the effect of mental health. There are still very limited studies in India, but clearly it does show that when you have extreme weather event, displacement of the population, it does affect actually mental health. Another key issue is heat health, more heat waves. And there are some, I think there was a Lancet article last year which was published, which showed that 55% increase in heat-related death in India between 2000 and 2021. Another thing, I mean, looking at the data actually crunched by the Indian Medical Research Council, showed that the number of stroke related to heat has actually doubled in India, and in particular in South Indian states, I think in Tamil Nadu in particular. Another issue is air pollution. I don't think here I need to go into the details, but clearly there are a lot of evidence. I mean, there were Lancet paper and multiple studies in India which shows that air pollution does lead, to death, but as well to different disabilities, in particular related to respiratory disease, cardiovascular disease. And as well, sometimes we tend to forget that air pollution does lead as well to neonatal disorders. And there are some data, backing up these statements actually in India. Another issue is the malnutrition agenda, clearly. Climate impact on malnutrition is extremely severe in India. I mean, stunting actually has increased by there are some estimates which show that it has increased by 32%, wasting by 42%, and underweight by 45%, and anemia by 63% because of the implication of climate. And then the vector-borne disease, I mean, clearly is increasing. I mean, I work in a state in Nagaland, and for the first time they had outbreak of dengue you know, in districts which had never seen many cases of dengue, and actually the capacities of the health system of hospitals, you know, to kind of have all these different patients being hospitalized for dengue was really problematic because they were not used to it. So clearly, you know, the increase of vector-borne disease, waterborne disease in the Himalayan states is very well known and documented as well. Okay, so when I talk about that, it seems there are many ways to be very pessimistic, which in some ways clearly, I mean, there is an effect of climate change on human health, but on the other hand, there are some good work, there are some good global practices being done at global level, you know, to kind of respond to the effect of climate change on human health, and including in India. I think many of my slides have disappeared. Some people want to finish the conference earlier, I can see. So this is actually one, so what we see is that in terms of the policy response, the first thing basically is to have the data. All the evidence I mentioned earlier are actually based, I would say, on standalone studies, but not necessarily on on data that you take from the... Oh, yeah, that's fine. Okay. Let me continue. So basically, I think it's important when you start, you know, planning, you know, developing a plan, an action plan on climate change and human health, you need to have data, basically, right? You need to have evidence saying that, yes, in my particular state, in my particular district, well, we have issue with heat health. Well, we have issue with outbreak of vector-borne disease. And so that's why, basically, a starting point is to do what we call a climate and health vulnerability assessment. That means to develop more evidence on climate and health. And so this is usually something which has been done in more and more countries. So this is a framework which was developed by the World Bank together with WHO. And it's no rocket science, but this is usually good practice to really support the development of your action plan. So you look basically at the climatology, so the climate hazard, and then you look at the effect of climate hazard on human health, which I've just, you know, talked about for India and globally. And then I think the most important aspect, you do a kind of adaptive capacity assessment, okay? So you know, I was talking about vector-borne disease just a few minutes ago in the case of Nagaland. So the health system has really struggled actually to address this outbreak because they did not have enough beds at hospital level. In particular, you know, in very remote district like Mon district next to Myanmar. Another issue is that, well, the skill set of the staff was not very appropriate because they are not used actually to have hospitalization for dengue. So basically, it really helps you to do a diagnostic, I mean, adaptive capacity assessment using the health system, you know, pillar to see where are the policy gaps and based on which, you know, you can set up your own recommendation. And then, you know, you come up with your action plan on climate change and human health. So these are just, you know, some examples from several countries where this has been implemented. I will not go too much into details, but I think one interesting case was Nepal, where they saw actually there were more and more heat waves, but Nepal was not used to that and the effect of heat, you know, on human health. So there was, they did the adaptive capacity assessment, and they saw there was a lack of local level policies actually and strategies to really address heat health risk, because the doctors were not necessarily able to diagnose heat-related disease. And so then one of the recommendations was to kind of review the basic package of health services and to ensure that it covers, so then, you know, they included heat-related disease and standard treatment guidelines, you know, to support the staff to kind of know how to address them. That's just one example. Another one in Pakistan, for example, the CHVA assessment, so Climate Health Vulnerability Assessment. The government of Pakistan did that in particular in specific provinces, and it showed that about 15% of hospitals were vulnerable to floods. So they needed to adapt the buildings to make them more resilient to floods and make sure that there is no discontinuity in terms of health services. Right. So before getting there, yeah. Sorry, I just have 2-3 more slides. So one thing I wanted to mention is the best practices on climate and health. So you see, we have both mitigation and adaptation intervention. So mitigation is basically what? Is actually making sure that any interventions, activities you implement in the climate health agenda contribute to decrease the emission of greenhouse gases, you know, the CO2, the carbon footprint, right? While adaptation is making sure that your health system is actually making it more resilient. So adapting it, basically, to any climate hazard. And so, basically, here is a summary of some global best practices on climate and health. So the first one, I think, is very common practice, and I'm sure it's implemented already in the state of Tamil Nadu, but that's the use of renewable energy, so solar panel, basically. Then the use of energy-efficient devices and equipment. So replacing energy-consuming light fixture with LED bulb and lights. Then as well, so having regular energy and carbon auditing of health facilities, etc. Then sustainable water harvesting and conservation methods. And as well, another one I would say, I'm not going to list them all, but I think an important one is the use of telemedicine and digital health that we talked earlier, because that means, you know, patients don't take transport, you know, to actually go to the facility, but can do that, you know, using digital tools. So that helps, obviously, with the carbon footprint. Then in terms of adaptation, there is a series of measures. The most common one are in terms of having an early heat health warning system. I think this is actually a best practice, which I would say comes from India. Because, you know, the Ahmedabad Action Heat Plan, actually one of the key interventions they had was this early heat health warning system. So sending messages, you know, to all the households so that they know what to do, you know, when it's super hot. And it really helped actually saving a lot of lives. So this is a very cost-effective intervention. I think the benefit-cost ratio is it's 50 to 1. So you invest $1 in that, you get a return of 50 USD. So this is an extremely cost-effective intervention. Then as well, in terms of adaptation, having integration of weather-related early warning systems with disease surveillance, having more awareness and information campaigns and programs, making health infrastructure climate and disaster resilient, and of course, preparation of all the action plans. It sounds a little bit, again, preparing an action plan, you know, a bit boring, but actually it does save a lot of lives. And again, I think the best example is the heat health action plan from Ahmedabad Municipal Corporation, which really helped to manage the heat waves from 2013 onward. So I wanted to have this slide. I hope it doesn't look too complicated, but normally this slide was going before the previous slide. This slide is important because what I want to highlight is climate health as a topic is new. Even if you take India, the National Program for Climate Change and Human Health is relatively new, from 2019. And so as of that, you know, all states have to have an action plan on climate change and human health. But however, and even globally, if you think about it, the COP28, that's the first time we had actually, you know, a health pavilion. So climate and health is a new topic. What does that mean? It means that the policy response, we are not still 100% sure of what's the best cost-effective intervention in the adaptation and in the mitigation aspect. So because of that, and it would be easy for policymakers to have a menu of action, you know, with cost-effective, basically action they can, you know, they can pick up based on the needs of the state. And so because of this gap, not having a list of best buys, you know, the most cost-effective intervention on climate health, the World Bank and Asian Development Bank, WHO, and several partners, these days are sitting together trying to come up with this list of menu of very cost-effective intervention for mitigation and for adaptation. So making sure that you decrease as much as possible the carbon footprint in a very cost-effective way. And making sure that you save the maximum of lives and you decrease the maximum of disability of the population in a very cost-effective way. So basically, through different types of intervention that right now are under review and will be available in the next 6 months. So one thing I wanted to mention, and I have only 2-3 slides, is, so we've seen there are several best practices at global level in terms of mitigation and adaptation measures on climate health. But in India as well, what I want to highlight is that there is already a strong policy framework on climate change. And I think this is really positive to see. And this is positive as well because I think initially health was not part of the National Action Plan for Climate Change. But it got integrated, so health in India got integrated into the Action Plan on Climate Change, I think in 2015. And then this led to the development of the National Program on Climate Change and Human Health under NCDC. And so then this led, basically there was the identification of 17 climate-sensitive illnesses, which of course are not, the prevalence are not necessarily the same depending on India, because as you can see, the vulnerability index is very different in India, whether you are in Rajasthan or in Tamil Nadu or in Orissa. So the disease pattern is a little bit different. And so based on that, basically all states are asked, as you know, to develop an action plan for climate change and human health. And usually most of this action plan integrate activities around mitigating air pollution-related illnesses, heat-related illnesses, vector-borne disease, extreme weather events, health and green and climate-resilient health facilities. One of the caveats, however, is that most of this action plan are not necessarily based on a climate and health vulnerability assessment. Remember the framework I was, discussing earlier. So now some of the states are actually doing this type of exercise, climate health vulnerability assessment to kind of update the action plan. So these are some of the great best practices, I would say, from India. Just to mention one, so Nagaland, for example, solarization of about 20% of the facility. Before solarization of the facility, only 10% of the facility had continuous supply of electricity, only 10%. Now, with solar panel being available in about only 20% of the facility, actually electricity is continuous, so 60% of the health facility have actually continuous access to continuous supply of electricity. And so not only this is decreasing, the emission of CO2, so on the mitigation, but this is helping as well with adaptation, because that means if there is continuity with electricity, there can be continuity of health services. A pregnant woman who has to deliver, she can continue, because she knows that there will be electricity in the health facility. So she will be incentivized as well to go and deliver her baby at the health facility. So those are kind of, I would say, best practices. Cool roofing work in Ahmedabad, clearly, I think Ahmedabad a lot of best practices for India in terms of both the adaptation and mitigation agenda. I was talking about the early heat health warning system as well as the action plan. And in Kerala, segregation and disposal of plastic waste in a hospital. So the way forward. So I think, so clearly climate change has an effect on all of us, on human health. In particular, I would say on the most vulnerable population. This is something I actually forgot to mention, but I would like to get back to this point. I think climate change actually does affect the most vulnerable population. The poor, the elder, pregnant women, and children. So clearly, a lot of, I would say, multiplying, factor, on health risk. That number one. However, even if we are still trying to figure out what are the best buys in this, to respond to climate health risk. I think the good news is that already many countries, including India, have started doing very good job in this area. I think what is important, perhaps the remaining opportunities, is to make sure that any, climate health activities get integrated into the health system pillar. and doesn't come like in a vertical way, because otherwise, you know, again, it's going to be a multitude of project, and then finance will be an issue, and implementation might become an issue. So it's important to strengthen governance and policy response to climate and health in a holistic way, in an integrated approach. It's important, and I think this is perhaps one of the most difficult parts, but to have this intersectoral coordination between various departments. And that's why in Ahmedabad, actually, municipality, the heat health action plan was well implemented, because there was alignment between all partners of the health system, hospital, Department of Health, municipality, but as well with the national authority, you know, for disaster management. So, this partnership is really very important. The same, if you take air pollution, you need to have this partnership between Ministry of Environment and Ministry of Health. Strengthening early warning systems and integration with disease surveillance. Generating evidence-based, I think this is a very important aspect. Sometimes we jump on doing the plan without knowing clearly what are the needs. And to know what are the needs, you need to have an assessment on what are the effects of climate change on human health at state level, at district level, at block level. So this has, you know, the generating evidence is very crucial, and using HMIS data. Making health infrastructure climate and disaster resilient, and finally developing financing pathway for decarbonizing health facility. Let me stop here. Thank you.
Thank you for addressing how climate change impacts maternal and child health, poverty, effects of air pollution on neonatal diseases and malnutrition, ma'am. Also, we thank you for exposing us the best practices in climate and health across India. We hope to adopt those practices soon, ma'am. Thank you. Now, I cordially invite our Deputy Director of National Health Mission, Dr. Sangeeta, ma'am, to honor the speaker.